Good afternoon, everyone. So today I'm Rajni Mehta. So she couldn't be here today because she's actually working on an RCA project out at the VA. So I've been fortunate to use RCA, the shared resource, in all of my studies that I've done to date here at Yale. So I feel I can kind of talk about the benefit of this shared resource to Cancer Center members. So RCA, or Rapid Case Ascertainment, was developed to facilitate studies of cancer that propose to use the state of Connecticut as a population laboratory. So it really allows us to get outside of Yale or Smilow Cancer Hospital and include the 30 other hospitals in the state to be able to look at various outcomes or exposures or whatever your research question is. It allows you to recruit faster, or to have a larger sample size into your study. So you can now think of Connecticut as your entire laboratory. It was incorporated as a shared resource in 1995 and then approved by NCI in 1998. And it functions as an agent of the Connecticut Tumor Registry, which allows RCA to obtain, after IRB approval, any information that would be reported by law to the tumor registry. So as you know, when anyone comes in and has a biopsy done and that's then sent to pathology, those results are then sent to the Connecticut Tumor Registry. RCA is able to obtain that information and share it with researchers interested in whatever research question, once it's IRB approved. So this data can be obtained from the Connecticut Tumor Registry or directly from the hospitals in Connecticut. So you can choose to work with 3 other hospitals, maybe large ones such as Bridgeport or Hartford or whatever, or all hospitals. You can work with Rajni Mehta on what you want to do, and she has great suggestions on, depending on the population or the research question, how many hospitals you might want to work with. So here are some examples of RCA studies. One is they do a lot of prospective interview studies where RCA identifies a newly diagnosed case of cancer. This can be within 1 week of their diagnosis. So it's rapid case ascertainment. At the hospitals, they can perform medical record abstraction, retrieve pathology slides, tumor blocks for standardization of different histologic interpretation and tissue assays. It can also, another example of a study are based out of the Connecticut Tumor Registry, where RCA identifies cancer patients from the CTR, collects information, and then performs abstraction and retrieval of slides and tumor blocks. So this is really important as there's a lot of novel questions that might be on more rare cancers or subtypes of cancers that there isn't enough patients here at Yale, and you can go beyond. I actually just completed a study where we were collecting tumor tissue from the biopsy and then from mastectomy or lumpectomy, and we completed this study a couple years ago, but we were needing some extra tumor blocks, and I thought, oh, this is going to be a nightmare getting tissue from Griffin and from these other hospitals, and I contacted Rajni, and she was wonderful, and within 2 weeks had these samples delivered, so it was wonderful. Yep. So it's, for example, the studies I've had that are IRB approved here, when we enroll patients, they complete a different consent form for each hospital, but RCA is magical in assisting this. They get the IRB approval at all the different hospitals and then help us in making the different templates and organizing it so we know if that patient's from this hospital or that, how to kind of do it. They organize it, so it's very easy. It depends on what your research question is. In my studies, we might enroll them post-surgery, post-treatment, years later, at diagnosis, so it depends. Yep. Yeah, so it was how our patients consented. And so there are different IRB, different consent forms, but RCA takes care of that. They get the IRB approved at all the different hospitals. They help you in creating the consent form templates based on that hospital procedure. So the billing structure, RCA works as a Yale Cancer Center internal service provider. It provides research and clinical service to investigators. And Rajni is wonderful in working with you on whatever your budget is. If you're putting in a large NCI grant and you have you know, anywhere from $20,000 to $80,000 to do this very large recruitment, and you can hire some of her staff where they are sort of a recruitment coordinator on your study, then that's great. But if you only have $1,000 to really help you with your research question, she can work with you on that. So it really depends on what you need, but she'll work with you on that, on the budget, to help help you reach your goals. So specifically what they do is they prepare IRBA submissions, they provide study coordination, so this is really important, especially if you only need staff help for a month or 2 or 3 and you don't necessarily have the extra staff to perform this. They can help you identify a cohort of cancer patients meeting defined eligibility criteria, identify newly diagnosed patients, contact and consent patients for you, collect pathology specimens, perform medical record abstraction, and other clinical duties as requested. The benefits, ability to identify a rare cancer or rare subtype of a common cancer, collect tissue, medical record information for each case, and drawing from the entire population across the state. They have many years of experience. I think Rajni's been director for 15 years or something. They have very strong IRB expertise and competitive hourly rates. So if you have additional questions, I'm happy to answer some of them here, or might be best too for you to reach out to Rajni. Thank you. Any other questions? Yep. So you would ask her what dates of interest to you. Is it from like 1990 on or 2000 on? Right. Right. So he's interested in looking at patients who've had radiation that also have a pacemaker. So I think you would want to work with Rajni on what do you think is in the state of Connecticut, the number of patients that have had radiation that have a pacemaker. So how many hospitals would you have to approach to do a medical record abstraction and whatnot? So she would help you figure out if you need to contact 1 hospital, 5 hospitals, or all 30, and then she would work with you on the consent form and the IRB approval and then obtaining the data. Yes. All right, thank you.